How are you guys doing today? I'm Dr. Kevin Marryshow. I'm here with Strength and You Therapy. I'm here with Carlo, who's a regular comer to Strength and You, maybe a little bit more than that. But today we're going to be going over a shoulder treatment in particular. We're going to be going over the benefits of what acupuncture can do for his shoulder, along with manual hands-on treatment. Carlo, go ahead and tell them a little bit about what's been going on with your shoulder, what you've been experiencing.
Okay. Guys, I've been training a lot lately, maybe 5-6 times a week, and I don't know if anybody else has experienced this, but I pay attention to my body when I train, and my contractions on my right side vary a lot differently than my contractions on my left side. So what I mean by that is when I fire the muscle, so when I do say a lateral raise or a shoulder press, I feel it more on the left side as opposed to my right side. I see that on my left side, my muscles are growing a little bit bigger than my right side. And, so we're gonna go through some testing. I talked to Kevin to help me out.
So, what Carlo described and the position that he's in right now is a really good place to start getting treatment, because it's these type of imbalances that you start to feel in your body that pretty much predispose you to injury. So for example, in Carlo's case, he feels like, let's say I know Carlo talks about his posterior or his rear delt, and a lot of those rear pull exercises, he feels like there's a lot more contraction than on the right side. And that could be for a lot of reasons. There could be a lack of perfusion to the muscle itself, which is increased blood flow or oxygen flow to the muscle. There could be a fact that that muscle is over fatigued because it might be compensating for what might not be firing in other muscles. A lot of times we look at that muscle as being maybe weak, but not necessarily. Some of the times the muscle in itself is just inhibited. Or another way to describe inhibited is your brain connection to the muscle, just the recruitment pattern isn't there as it optimally can be. So what Carlo's gonna do is, if he can't optimally recruit that posterior delt, he's gonna use whatever other muscles in the area to get the job done. And as that happens, we get fatigability of other muscles, and what we call it is a failure to adapt, or the injury comes on because he's asked other muscles to do a job of another muscle, and then it just kind of tires out and is like, I don't want to do this for you anymore. And that's when pain comes on, which is really important why we can't go chasing pain or only look for pain. Because if Carlo's pain happens to be, let's say, in his neck or in his upper trap, levator scapular area here, we could go at this all day long, but if the stimulus is coming from the inability of his rear delt to fire, then we're pretty much at a lost cause if we focus on this. So that's why I assess the entire shoulder, well, when we're treating the shoulder, the entire shoulder girdle as an entire unit to try to restore the function as opposed to just chasing the pain. So we're gonna do some muscle testing here on Carlo. So I'm gonna get him to bring his arm right up. Actually, we're gonna start with the side that he feels fires at a better capacity. Bring his arm up right here. I'm gonna get you to push up while I push down. Good, push up, push. Good, and relax. And this side up here, get you to hold up there. Good, push up while I push down. Push. Good, relax. Let's do that one more time, this side. Hold up, push up while I push down. Push up, push. Good, relax. This side one more time. Go ahead and push up while I push down. Push. So there's not a huge inhibitory difference, but I still am able to move his right side a lot easier than his left. In particular, I'm trying to check to see if his serratus anterior is stabilizing his shoulder girdle or his scapula against his thoracic cage well, and the left side seems to be doing a little bit better than the right side. Now we're going to take a look at how Carlo's external rotators fire, see if there's anything that we find with that. So we're going to go to the stronger side here first. Okay, so you're going to come back right here. I'm going to be pushing you down, you're pushing back at me. Okay, go ahead. Push back, push. Good, relax. Okay, and let's see what this side here gives us. Okay, same thing, go ahead, push back. Push. Okay. One more time on this side. Push back. Push. So all I'm doing here is I'm literally just meeting Carlo's resistance. I'm gradually increasing the pressure that I'm putting as he pushes back at me, and I'm seeing if he can maintain it. This side just can't maintain. I know it kind of seems crazy, like, maybe he's not trying as hard on this side and the left side, but I'm maintaining the same intensity of pressure that I put as he pushes back against me, and this side just doesn't stabilize the same way the left side does. So again, in Carlo's case, he might be feeling, less ability to fire through his chest or whatever he's feeling on the right side, but it could be a product of, again, over fatigue of these muscles because his external rotators aren't really doing what they should be doing optimally. So we're going to go through here now with Carlos. First, we're going to use some we're going to put in a couple of needles into his external rotators, and we're going to try to activate his axillary nerve, which stimulates his entire deltoid muscle. We're gonna go with that. We're gonna retest after. Before I retest after, I'm gonna do some manual cleaning up of the tissue, and then we'll see when we retest what type of activity we get.